So from everything we've talked about, the way that bones are made and depositing all of that calcium in there and all of the collagen and the proteins, should be obvious that bones have great strength, but they can break as a result of unusual stress or sudden impact. We call those breaks fractures, and we classify them in several different ways. A stress fracture is a very thin break caused by increased physical activity, especially when there is a repetitive load, such as in running. A pathologic fracture occurs when a bone has been weakened by a disease. A simple fracture is one where the bone doesn't poke out of the skin, and a compound fracture, one or both ends poke through the skin. On this slide, you see several types of fractures along with a very brief description of these, such as comminuted, the bone is broken into many pieces. Compound or open, the bone sticks through. Displaced, the bones are no longer aligned. Green stick, it only breaks part of the way through. Oblique, at an angle. Okay, so make sure that you know just the basics on these, and again, no more than what is printed on the slide. The healing of a simple fracture tends to take about 2 to 3 months, but a compound fracture is going to take longer to heal. Fractures heal much more quickly as we are young, with an average healing time of approximately 3 weeks, and that healing time increases dramatically as we age. Now, in the elderly, remember, we have that normal thinning and weakening of the bone, so that's going to increase the potential for fractures, and some of those complicated fractures require surgical intervention if they are going to heal properly. So reduction is the alignment of the broken bones. Closed reduction is just done with manual manipulation. So for instance, if your arm is broken, the doctor may grab the two parts of your arm and forcefully realign those bones simply by moving your arm. Now, that's closed. Open reduction, think of opening the skin. So this is surgical reduction, where pins and wires and plates are used to hold the bone together through the healing process. Now, most of the time, this is also going to require immobilization, which could be done by placing the broken bones in a cast or putting the patient in traction, which keeps that part of the body immobilized. Now, all of this is going to depend on the severity of the break, what particular bone is broken, and the age of the patient. So bone fracture repair has 4 steps. The first step is when the fracture has torn the blood vessels inside the bone. Remember, bone is very highly vascular. The blood vessels get torn in the bone and in the periosteum, and that causes bleeding and results in what is known as a fracture hematoma that forms a blood clot. The second step is when the soft fibrocartilaginous callus forms. So regenerated blood capillaries are going to grow into that hematoma. The fracture hematoma is reorganized into an actively growing connective tissue. We call that a procallus. The fibroblasts within the procallus start laying down collagen fibers. Remember, fibroblasts build fibers. That's going to help connect the broken ends of the bone. Then chondroblast, cartilage builders, in that new growing connective tissue starts to form a dense regular connective tissue associated with the cartilage. Eventually that procartilage is going to become what we call a fibrocartilaginous, so fibrous cartilage, or a soft callus that lasts about 3 weeks. This is going to be replaced in the third step by the forming of a bony hard callus. So within a week after the injury, the osteoprogenitor cells that are adjacent to that fibrocartilaginous callus become osteoblast. What do? They build. So they produce trabeculae there in that area. The fibrocartilaginous callus is going to be replaced by bone, and that is the hard bony callus. The trabeculae of the hard callus are going to grow and thicken for several months, and then the final stage is remodeling, So that hard callus is going to stay in place there for about 3 to 4 months as osteoclasts remove bony material from both the internal or the exterior and the interior surfaces, excuse me. So compact bone is going to replace the primary bone. The fracture usually leaves a thickening or an enlarged area there where the healing took place. Now, in some instances, healing occurs without any obvious thickening, but it depends on several factors, including the severity and location of the break. And once again, here we have the table of the hormones that affect the way that we grow, maintain, and repair bone. Now, I want to remind you at this point, we pulled a bit of Chapter 8 into this Chapter 7 lecture, especially at the beginning parts of the chapter. The remaining parts of Chapter 8 will consist of two different things. One, learning to identify bones, their categories, their divisions, their bone markings. The other part, of course, is going to be a little bit more of bone disorders. I'm going to cover the bone disorders in another couple of videos. However, all of that bone identification and the markings and so forth, you will cover in lab, so they will not be a part of this lecture.